So John, why don't you tell me what happened?
Well, it seemed like a pretty normal day. Mike brought in donuts to celebrate his own birthday. Only he would do something like that. Paul was working on his own projects in the shop, and I had Emily start replacing some of the broken glass in the windows. Everything was off to a normal day, but then, geez, everything changed.
Got another piece of glass for you.
Great, thanks.
Hey, John.
Hey, Greg.
John, we need your help!
Well, I heard this huge crash. I'm one of the trained first aid providers for this shift, so when I heard the crash, I went to go help. The floor was covered in glass. My first aid training just kicked in at the moment. Emily was in a lot of pain. Paul was really scared. He just joined the first aid team, but I knew I was going to need his help.
I understand you're new to the first aid team. How did you feel?
It was intense. Way more than I thought it was going to be.
Some employees face significant health risk as a result of exposure to blood or other potentially infectious material, or OPIM. In 1991, the Occupational Safety and Health Administration, or OSHA, issued the Bloodborne Pathogen Standard,
BVP class right now.
which applies to all employees who can reasonably come in contact with human blood and OPIM in the course of their job activities.
Okay, I'm ready.
The purpose of the standard is to protect employees by minimizing or eliminating exposure to disease-carrying microorganisms or pathogens that can be found in human blood and other body fluids. Every year, all employees with the potential of occupational exposure must receive training on bloodborne pathogens and exposure control methods.
All right, guys, let's get started. The most concerning bloodborne pathogens are the hepatitis B virus, the hepatitis C virus, and the human immunodeficiency virus, or HIV, the virus that causes AIDS. Other recognizable bloodborne diseases include syphilis and viral hemorrhagic fevers, such as Ebola. Not all of these bloodborne pathogens are contagious to the same degree, nor have the same symptoms. Some people can be infected and contagious, but show no symptoms. So now we're going to watch a video on primary pathogens to learn more.
The hepatitis B virus, or HBV, can cause hepatitis, an infection that causes inflammation of the liver. An acute HBV infection can occur when a non-infected person is exposed to the virus. A chronic HBV infection can develop over time if the virus remains in the body. Life-threatening complications of hepatitis include cirrhosis of the liver cancer, and liver failure. Symptoms of someone infected with hepatitis B can include fever, fatigue, loss of appetite, nausea, vomiting, abdominal pain, dark urine, clay-colored bowel movements, joint pain, and jaundice, a yellowing of the skin or eyes. Not all people infected with HBV show symptoms, but even without symptoms, HBV-infected individuals can still be infectious to others. The hepatitis B virus can be infectious on surfaces for up to 7 days in the presence of dried blood, increasing the risk of exposure through indirect contact. There are no medications available to treat an acute HBV infection. Limited medications are available for chronic infections. A vaccination to prevent HBV infection is available. It has relatively few adverse side effects and is well tolerated by most of the population. The hepatitis C virus, or HCV, can cause severe liver damage in a manner similar to HBV, including both acute and chronic infections. Most people with an acute HCV infection do not display symptoms. When they do occur, they include the same symptoms that can occur with HBV. Just like with HBV, HCV-infected individuals are still infectious to others, even if they show no symptoms. Similar to HBV, HCV has increased risk of indirect exposure. HCV can be infectious on surfaces for up to 3 weeks in the presence of dried blood. Currently, there is no immunization available for HCV, but treatment is available for an acute infection that can reduce the risk of the disease becoming chronic. However, there is uncertainty about the treatment and when it should be started. The human immunodeficiency virus, or HIV, is the virus responsible for causing acquired immunodeficiency syndrome, or AIDS. The virus attacks and suppresses the immune system. It specifically targets the cells that are crucial for fighting infection from invading organisms. This allows other diseases and infections to progress in the body without resistance. Similar to HPV and HCV, many of those infected with HIV will not show any symptoms of infection, but still be potentially infectious to others. Early symptoms could include fever, chills, rash, night sweats, muscle aches, sore throat, fatigue, swollen lymph nodes, and mouth ulcers. It could take many years before an HIV-infected person shows symptoms of disease. As the infection progresses to AIDS, more severe symptoms can occur, generally related to other opportunistic infections that occur due to a weakened immune system. Different than HPV and HCV, HIV poses a much shorter risk of indirect exposure. HIV is very fragile and can only survive for a few hours outside of the human body. There is no immunization or known cure for HIV. Effective, new drug therapies can keep HIV-infected persons healthy longer and have dramatically reduced the death rate.
Now, of the three major bloodborne pathogens, HBV is the most contagious, with up to a 1 in 3 chance of getting infected if you've been exposed, if you have not been vaccinated. HCV is the next greatest risk of transmission, with an up to 1 in 50 chance of being infected. Comparatively, HIV is much less contagious than any hepatitis virus, with the highest risk of occupational transmission being about 1 in 300. The hepatitis B vaccination is very effective at protecting against the hepatitis B virus.
Childhood vaccination for hepatitis B has contributed to an overall 96% decline in acute HBV infections of children and adolescents. The majority of new HBV infections now occur among adults, including through occupational exposure. Your employer must offer the hepatitis B vaccine for free to any employees determined to be at risk of occupational exposure prior to undertaking any tasks that could result in an exposure. The entire series of 3 shots is needed to provide full immunity. The vaccine is safe with very few adverse reactions. A physician or other licensed healthcare professional will perform or supervise the vaccinations. Your employer does not have to offer you the vaccination series if you have previously received the complete series or have tested as immune to HBV.
Okay guys, if you could take one and pass it back. This is our declination form. You can refuse the vaccination for hepatitis B after hearing all the risks and all the benefits. To do this, you must sign a declination form.
Shots? 3 of them?
Yes, there are 3 shots total over a specific period of time. If you initially decline the Hep B vaccine, you can ask the company at any time for it at no cost to you.
It was a mistake, I know. I just don't like getting shots.
Now, let's talk about the facility's exposure control plan. The company's exposure control plan is a requirement from the OSHA bloodborne pathogen standard. It outlines the strategies necessary to eliminate or minimize employee exposure to blood and other bodily fluids. This site-specific plan defines which employees are covered under the OSHA standard, how to minimize the risk of an exposure, and how to handle an exposure if one were to occur. It's important for you to know that your job classification does put you at risk for exposure. Now let's watch a little bit more of the video.
The plan includes the identification of job classifications that your employer has determined to include tasks and procedures that have risk of exposure to blood and other potentially infectious materials. It is important to know that your job classification puts you at risk for occupational exposure. Since your job classification does put you at risk, be aware of the specific tasks or procedures that cause exposure. The plan also explains how your employer has decided to make you aware of potentially infectious materials in your workplace. Biohazard signs and labels are used to indicate hazardous material, including potentially infectious material or anything contaminated with blood or body fluid. A biohazard label or sign should be attached to each object or container of contaminated material by string, wire, adhesive, or another method that prevent loss or unintentional removal of the label or sign. When red bags or containers with the biohazard symbol on them are used, a sign or label is not necessary. Properly indicating contaminated material using labels and signs will greatly reduce the risk of accidental exposure to the contaminated material. Be sure that you are aware of and abide by all signs and labels signaling hazards and hazardous material. The exposure control plan at your workplace will also identify the site-specific methods used to reduce the risk of occupational exposure. Engineering and work practice controls consist of procedures to help you complete your job tasks with a minimal risk of exposure. Personal protective equipment isolates your body from contact with potentially infectious material. Housekeeping protocols keep potentially infectious material from lingering on surfaces. The proper containment and labeling of potentially infectious material ensures that these items are handled appropriately. Another key part of the plan includes listing the site-specific means by which the facility will reduce employee risk, including appropriate training, the communication of hazards, and hepatitis B vaccinations for any employee who has an occupational risk of exposure. The final part of the plan describes the detailed procedures for the investigation and evaluation of exposure incidents in order to quickly provide effective follow-up care to exposed employees. The plan may also call for specific record-keeping of incidents, including documentation of the route of exposure, how the incident occurred, and consent for medical testing.
So this exposure control plan is accessible to all of our employees. We review it and update it annually, or when changes in procedures cause a new risk of exposure. Does anyone have any questions?
Were you prepared for what happened?
There was a lot of blood. We'd just taken our annual BBP class and went over our exposure control plan and safe work practices. I don't think everyone always pays that much attention, but yeah, I feel like I knew how to respond.
The transmission of bloodborne pathogens occurs through direct or indirect exposure to infected body fluids. The primary ways exposure to bloodborne pathogens occur in an occupational setting are through non-intact skin, such as a cut or abrasion, through the mucous membranes of the eyes, nose, or mouth, or through a puncture wound from a sharp, contaminated object, such as a syringe or broken glass. Outside an occupational setting, the common modes of bloodborne pathogen transmission are sexual contact and shared hypodermic needles. Casual contact like shaking hands or hugging does not transmit bloodborne pathogens. Indirect contact with an intermediate object such as a work surface or doorknob that has been contaminated with body fluids can also cause an exposure incident.
What happened next?
I asked Paul to go activate the emergency action plan and to go get the first aid kit.
I can help. Just keep squeezing it with your hand, okay? Paul, call Dana and activate the emergency plan. And bring me the first aid kit from the hallway.
Okay.
Body fluids that have a risk of transmitting bloodborne pathogens in an occupational setting include blood and cerebrospinal fluid. Semen and vaginal secretions can also transmit pathogens during sexual contact. In the absence of visible blood, some body fluids have no documented risk of transmission. However, during an emergency, you may not be able to tell which fluids you are handling or whether injury has mixed them with blood. It is best to simply consider all body fluids as potentially infectious. Work practice controls and engineering controls help prevent the transmission of bloodborne diseases in the workplace. Work practice controls focus on the manner in which tasks are performed. For example, using personal protective equipment such as disposable gloves when performing first aid is considered a work practice control. Engineering controls reduce exposure in the workplace by either removing or isolating the hazard, such as providing an appropriate disposal container for needles. Your employer is required to examine and maintain or replace engineering controls on a regular basis.
And when you got back?
John put on some gloves and started to help her.
I'm going to take the pressure over with this, okay? We knew Emily was going to need further medical care. Our initial goal was to try and stop the bleeding.
Standard precautions is a recommended approach to any scene where blood or other body fluids may be present. This means treating all body fluid as potentially infectious, even that of someone you know well. Personal protective equipment, or PPE, is specialized clothing or equipment that isolates your body from contact with potentially infectious material. Effective PPE must not permit potentially infectious materials to pass through or reach your skin, eyes, mouth, or clothes under normal conditions of use. Your employer will make PPE available to you in the appropriate size and at no cost. Non-latex alternatives will also be made available to employees who have allergic sensitivity to latex. Employers must also properly clean, launder, repair, replace, or dispose of contaminated PPE as needed. Always wear disposable gloves when there is a possibility of hand contact with blood or other body fluids. Replace gloves as soon as possible when torn, punctured, contaminated, or if their ability to function as a barrier is compromised.
Emily looked really uncomfortable, and when I leaned in to reassure her that we were there to help, I cut my hand on a piece of glass on the floor, right through the glove.
Could you tell what had happened?
It wasn't clear at first. He'd show me his hand, but then I saw blood on his glove.
Go take care of that right now. I'll stay here with Emily.
Okay.
So then what did you do?
I went straight to wash my hands.
If an exposure occurs, immediately care for it yourself. When a potentially contaminated sharp object creates an open wound, wash and irrigate the wound with soap and large amounts of running water. If you suspect an exposure from potentially contaminated material to the eyes, nose, or mouth, flush the affected areas with large amounts of running water. If potentially contaminated material gets onto unprotected skin, wash it off as soon as possible with soap and water.
So when did you see Paul next?
Soon after he had left, other team members had arrived to take over Emily's care. So I went to go check on him.
How are you doing?
Okay. Cut's not bad. I'm just trying to wash it out real well. I think there was a little blood on the glass.
Here, let me get these out of the way.
Place contaminated protective equipment in appropriately designated areas or containers for cleaning or disposal. Remove contaminated gloves by turning them inside out. Be careful to prevent any splashing or spraying of blood and other body fluids. Never wash or decontaminate disposable gloves for reuse. Wash your hands immediately whenever blood or other potentially infectious material was present, even if you were wearing gloves. If soap and running water are not available, alcohol-based foam or gel hand sanitizers can be used.
Here, use this to dry your hands and keep pressure on the cut.
Thanks.
What did you do after washing your hands?
Paul seemed a little shook up. so we went to go check out the exposure control plan. We wanted to determine how to report the exposure.
I didn't really pay much attention in BBP training. John tried to reassure me that exposure to blood wasn't necessarily an infection, but I had to go through the process.
So that's when you followed up with your supervisor?
Yeah.
If an occupational exposure does occur, it is important for you to follow the employer's written procedures for handling medical self-care and evaluation, as well as for documenting the circumstances of the exposure. After an immediate care, report any exposure incident without delay. This allows for timely testing of the source individual and, if necessary, the person who was exposed. In order for an exposure to blood or other body fluid to cause a disease or infection, there are 4 links that must be in place. First, a pathogen must be present in the blood or body fluid. Then, there must be enough of the pathogen to overwhelm the immune response. There must be a suitable entry site for the pathogen to enter the body, such as a break in the skin, or the mucous membranes of the mouth, nose, or eyes. The person affected must have a susceptibility to the pathogen, such as a weakened immune system or pre-existing condition that makes a person more likely to become infected. Exposure to a pathogen does not mean that a disease will occur. It depends on whether all links of the chain of infection are present. By eliminating at least one link, the likelihood of infection is reduced.
It's important to follow up on the exposure right away. Emily is doing well and has agreed to be tested. I've also arranged to get you in the clinic for an evaluation.
Anyone affected by an exposure will be directed to a healthcare professional for medical evaluation and testing as soon as possible after receiving the source individual's test results. The evaluation will document the route of exposure and how the exposure occurred. There is no cost to an employee for this evaluation.
The results of your testing are confidential and are reported only to you and to me as your provider. No one else is notified of the test results, including your supervisor and anyone at your work.
If an employee has been exposed to HIV-infected blood, most medical facilities offer short-term therapy called post-exposure prophylaxis, or PEP. This therapy must begin as soon as possible after the exposure. PEP can reduce the risk of getting HIV by as much as 80%. The evaluation will also include counseling and education regarding the testing process and the ramifications of exposure. This includes safe sexual practices information for the 3-month post-exposure evaluation period.
After Paul went to see his supervisor, what did you do?
I went back to the shop to go clean up the mess. I needed to pick up all the glass, and everything needed to be decontaminated. I put on some new PPE and I got started.
The term regulated waste refers to specific categories of waste that require special handling, including blood and other potentially infected materials. Regulated waste can be liquid or semi-liquid blood or other potentially infectious materials, or contaminated items that would release potentially infectious material in a liquid or semi-liquid state. It also includes any items caked with potentially infectious materials that are capable of releasing these materials during handling, and contaminated sharp objects.
How did you manage the cleanup?
I carefully picked up all the glass and decontaminated everything with a disinfecting solution.
It is of the utmost importance that infectious waste be safely contained. It should be placed in specially designed containers constructed to contain the contents. The containers need to be leak-proof, labeled, or color-coded, and closed prior to removal to prevent spills. If a container is leaking, place it in a secondary container that is appropriate for handling liquids or semi-liquids. Pick up potentially contaminated broken glassware using mechanical means only, such as tongs, forceps, or brush and dustpan. Never use your hands, even if you are wearing gloves. Contaminated items should not be stored or processed in a way that requires anyone to reach into containers where the contents cannot be seen or safely handled.
What else besides the glass did you take care of?
Emily's vest got blood on it, and it was still there.
Contaminated laundry is laundry soiled with potentially infectious material or that may contain contaminated sharp objects such as needles. Contaminated laundry should be handled as little as possible. Wear gloves when handling contaminated laundry and place it in labeled leak-proof bags or containers before transporting it. Do not take contaminated protective clothing home for laundering. Proper containment and labeling of potentially infectious material ensures that these items are handled appropriately. Keep potentially infectious material from lingering on surfaces. All equipment and work surfaces that could be contaminated should be cleaned and decontaminated routinely, using an appropriate disinfectant while wearing PPE. All pails, bins, and similar reusable receptacles should be decontaminated on a regular basis and as soon as possible after visible contamination is noticed. Cleanup and decontamination of contaminated objects and surfaces are very important in helping reduce future exposures from indirect contact.
Thank you, John. I appreciate your help. An important part of the exposure control plan is the investigation and evaluation of the circumstances surrounding an exposure event. This investigation will help us learn from what happened and to establish measures to prevent it from happening again. Is there anything else that you'd like to add?
Well, not much. Once I got finished, it was back to business as usual. Well, sort of. I hear Emily's doing okay, and will return to work soon. I know Paul learned a lot from what happened. While it wasn't perfect, and it was unexpected, I'm sure glad we were prepared.